My name is Emily and I am the Consultant Pharmacist in the rheumatology team here at the North Bristol NHS Trust. I'm going to talk to you about some of the medication used and principles of management in early inflammatory arthritis. You may have heard of the names of lots of different drugs used to treat arthritis, including some of the pictures you can see here. This may have left you feeling confused and overwhelmed. It can be daunting when you are first started on treatment for your arthritis. But we are all here to help you, either during your consultations, which could be face-to-face or remote clinics by telephone or video calling software, via the rheumatology advice line, or you can ask your pharmacist in your local community pharmacy or GP surgery to help answer medication queries. Let's start by trying to understand an important message about your medication. Think of a kitchen sink with the plug stuck in the plug hole and the tap turned on fully. What would happen? In this situation, it is very likely that the sink would overflow, causing an unmanageable mess. How could we minimise the effects of this if we do not have a cure and can't remove the plug? Firstly, we could throw some sponges into the sink to try and mop up some of the effects. We have medicines that act in this way by helping to absorb the effects of your inflammatory arthritis by helping to control your symptoms. Examples include painkillers, anti-inflammatories and steroids. We could also try and reduce the cause of the problem by trying to turn off the tap. We have medicines that work in this way by trying to modify the course of the disease, and they are known as disease-modifying anti-rheumatic drugs, or DMARDs for short. It is important to note that steroids can actually be used for symptom control and disease modification, but side effects restrict their long-term use. Let's talk about the medicines used for symptom control, acting like sponges to help absorb the effects. These are usually prescribed and managed by your GP. Examples include simple painkillers like paracetamol. Paracetamol provides the most benefit if taken regularly, usually 2 tablets every 4 to 6 hours and a maximum of 8 tablets in a day, unless you have a particularly low body weight and we can discuss a lower dose with you. Other examples include non-steroidal anti-inflammatory drugs, also known as NSAIDs, for example naproxen or ibuprofen. These drugs we aim to use on a when required basis. They are available as tablets or gels that can be applied to the affected area. We also mentioned steroids, which are effective at relieving symptoms quickly. They can be given by tablet, injection or a drip infusion in hospital. Tablets should be taken together as a single dose in the morning and they should not be stopped suddenly unless advised to do so by your specialist. Example side effects of these steroids are listed. Taking steroids with food can help reduce the chance of stomach upset. Now let's talk about the medicines used to slow the progression of the disease and reduce the cause of that sink overflowing. We have a group of medicines known as conventional synthetic disease-modifying therapies, or DMARDs. These are the medicines that have been used for many years to help control inflammatory arthritis. You are usually started on one of these very soon after being diagnosed, and your doses may be increased or more than one drug added in fairly quickly to help try and get your condition under control as soon as possible. If your disease is not controlled, you may be started on a biologic disease-modifying therapy, which is given by injection or infusion, or one of our newer targeted synthetic disease-modifying therapies, which are given in the form of tablets. It is common to stay on at least one anchor conventional synthetic DMARD if tolerated. The conventional synthetic DMARDs take approximately 3 to 12 weeks to be fully effective, which is why we also recommend medicines to help with your symptoms in the meantime. Do you know where you could find out more information about these different medicines? There are some very helpful charity websites that provide very clear patient-friendly information. For example, Versus Arthritis, which has useful booklets on each type of medication. And the National Rheumatoid Arthritis Society, known as NRAS, has a comprehensive booklet called Medicines in RA, and this is available online. Methotrexate is an example of a conventional synthetic disease-modifying therapy and one of the most commonly used. It is available in tablet or injection form. Common side effects include nausea, diarrhea and reflux. Serious but rare side effects include neutropenia, which is a blood cell abnormality, and methotrexate pneumonitis, which is a lung problem. It is important to immediately report the onset of sore throat, bruising, mouth ulcers, vomiting, abdominal discomfort, dark urine, and shortness of breath, as these may indicate something serious. Folic acid can help reduce side effects of methotrexate, and it's usually recommended to take it either once a week or up to every day except the day of methotrexate. When collecting your methotrexate medication from your community pharmacy, always check the tablet strength and check that the label says it should only be taken weekly. It is important to limit alcohol intake to within national recommendations. Here is some other guidance specific for the conventional synthetic DMARDs. And note, the information here is not the same for the biologic and targeted synthetic therapies. For the conventional synthetic DMARDs, blood monitoring is carried out at your GP surgery under a shared care agreement. Initially, monitoring is every 2 weeks, but can be less frequent when your dose and results are stable. These drugs do not normally need to be stopped prior to having surgery, although your steroid doses may change. These drugs do not normally need to be stopped if you have an infection, unless you are given antibiotics by a drip or admitted to hospital, or if you are advised of an interaction and told to stop them. It is safe and recommended to have the annual flu vaccine, and we recommend you doing this, but live vaccines may need to be avoided, and this is often dose dependent, and you can contact our advice line if you're unsure. This is the most important slide. We want you to become the expert in your medicines. It is important that you get to know your medication. Make sure your GP records are kept up to date. Keep a list of your own medication with the doses that you take. Always inform your doctor, dentist or pharmacist when you are taking medicines. And never run out of medication. Don't be afraid to ask if any new medicines are likely to interact with medicines you are already taking. And aim to get the most out of your appointments by thinking ahead about questions you might like to ask, including those appointments that are by telephone or video calls. We have a DMARD booklet available which you can request in clinic, or it can be posted to you. It includes a chart to help you keep a record of when you need to take your medication. There is a space to enter the drug name, say what it is used for, and we can help you with this, and enter the dosing instructions. This might help you remember to take your medicines, particularly when they are new or your doses have been changed, and you can update this regularly when your doses are changed. And finally, the key take-home messages. Think about what medicines work for you to help control your symptoms. What medicines have been prescribed to try and slow the progression of your condition? And how can you become an expert in your medicines? Thank you for listening.